we do things, steroids is not good for, we know that, but we got to take it because it's very good for treatment combined with other treatments for myeloma. But we reduce the risk by adding in bisphosphonates, bone injection, taking calcium and vitamin D3, and doing physical exercises. So it's, trying to reduce the damage we have, because we don't have another choice of avoiding steroids generally. Yeah. And I also want to tell you this, the study of comparing high-dose DEXA, which is like 12 days of 40, versus 1 day of 40, which was done by in a US group, was recommended by a patient. So he said that, I'm having too many side effects. Can we compare and do a study where we use high-dose dexamethasone and compare with low-dose dexamethasone? And it was done by the cooperative group on a patient's request because he found that, it's too much for him. And after that, it became a standard of care. So I'm just trying to say that, patients involve a lot more in US, and I think we should get there as well. So there should be studies which are looking at quality of life, for example. They should be looking at things that you see, we can't see. Because we are here, sitting here, we don't see your, things going through. So I think that's why, this sort of forum, should generate ideas and questions that we can, put into our future studies so that we can get some answers out.
Hello. Yeah, my question. Can I talk? Yeah.
How much time do we have?
Yeah. Hello, I'm Nirmala.
Yeah.
No, maybe two. This one and
two. Fast, yes.
Let's last two.
Oh.
Three.
Okay. Yeah. I'm Nirmala. I'm out of the treatment now. Only oral is there. But I'm complete vegetarian. The problem is that my hemoglobin is 10.2. It's not coming up.
10.2?
Yeah. So it's not coming up. Because okay. I'm vegetarian, so I cannot take meat, egg, or anything. So what you suggest me to do?
What treatment are you taking? Thalidomide, is it?
My professor is there.
Oh, MLN. Okay. So ixazomib can... Well, technically cause low blood. We've seen it. It can cause low blood in some patients. But has it been going down or remaining stable? Stable. I mean, 10.2 is good enough.
Oh.
Yeah. Don't overtreat. I mean, we got to be happy with a stability, right? I mean, you can take multivitamins, iron, maybe, B12. If you're not taking liver meat or whatever.
I'm taking injection B12.
Okay. Once a month, once in 3 months?
Once at 3 months.
Okay, I think that's enough.
That's enough.
Yeah.
Yeah, actually,
Any
interesting
diet,
question for like vegetarians.
Diet for me.
Since that, ma'am, you don't take egg at all, so normally from the vegetarian sources, the iron will be green leafy vegetables, spinach, okay, kailan, chaisim, for example, broccoli, right, and nuts and seeds, beans and peas. But usually the iron sources from the plant will be a bit poorly absorbed by the body. So normally to aid in the absorption of iron, it will be vitamin C. So remember to have your fruits every time during your main meals to help in the iron absorption.
Thank you. Thank you.
Is the transplant stem cell years methods the same as in United States? And the second, at the blood taking place, there are 2 nurses, and one nurse almost always succeed to take my blood, but the other nurse after want to take, then she said, your vein is too small. Sorry, I have to take out and give it to my other friend, and already happened twice. Can I choose the nurse? And
Okay, very easy questions to answer. So the transplant is exactly the same as in the US and in Europe. Our transplant center is inspected by inspectors from the US actually, and it's fully accredited. So the standards and the quality, the SOPs and everything that we do is exactly of international standards. So you don't have to worry about that. Blood taking is always challenging. We have patients with very small veins and so on. We have expert blood takers and not. So next time you come, you just request this. They will try to help you, but by having small veins shouldn't discourage you from doing the stem cell transplant, because when we do the transplant, we actually put in big tubes to precisely avoid the need of using small veins for blood taking and giving drugs. So, that will not be an issue. That will not be an issue. Yeah. So you can request for your favorite phlebotomist. Yeah, don't worry. Okay, last one, because we have people getting ready to entertain you and you don't want them to entertain. Okay, so last question.
Yeah, there is two.
Okay.
Two questions, which is easy for you. One is in Jakarta now there is a more suggestion to use the alkalis water rather than acid, the normal one. So for me, it's can be scary because the brand that sells become more higher and higher. Say it alkali to 8 until 10, and then now become 12. Then I know that we are not machine, so please, the dietitian give me the suggestion. And then the second, since and after transplant and we recover, there is also still a question about whether we need to have vaccines, since we are come to the new stage like that before, or how if we not take it, or could be there is some what the check to check it whether we need or not. Thank you.
So the first question is on alkaline water, right? I actually don't know about alkaline water much. My general suggestion for these kind of things is, there's no reason to do all these extra things. Let me twist it the other way around. If it's something that we need to do, I would have told you already, right? So the other things are extra, and not very evidence-based. They are not very strong, and there are a lot of different things that, you will read that you must do this. A lot of people like to take some things to boost the immune system also. After I recover, should I take this to boost my immune system? So all these things I really would just simply say I wouldn't recommend it. There is no clinical evidence to suggest that people should use that. But I am also not able to stop completely. For example, what you do in Jakarta, I cannot go there and stop. So I can only give my advice. The vaccination, I think now the increasing evidence is that perhaps it will be good to vaccinate people after the transplant. Although I'm not sure that is again based on very strong evidence. We certainly have many patients that have transplant that never had vaccinated, that had no issue with any of these infection as well, right? So, but we are kind of standardizing our protocol, and I think moving forward we will recommend vaccination for all our post-transplant patients. So again, for those who had transplant in the past that hasn't had vaccination, when they come, we will have a discussion to let them know, that if they want to have the vaccination, they can have it. But moving forward, all the new transplant cases would have vaccination as a standard after a certain time. But again, that's more precautionary than, I'm not sure that there is very, very strong evidence that if you don't have vaccination, you will have very nasty, severe infection all the time. Because we certainly have many patients who have no problem, right? So that's my answer.
Yeah, I think the only concern is sometimes you get flu after transplant, and the doctors worrying, had I given flu vaccination, this may not have happened. Okay, but in reality, we don't know. But in SGH is a standard that everybody after 6 months get a flu vaccination and pneumococcal vaccination, and there's a calendar that we give to all our patients after transplant, and auto and allo, or both kind of transplant. And I don't know whether it really helps in terms. We have not compared. We instituted this in 2015, so we've not done a comparison before and after compulsory vaccination to see if that's made a difference. But probably in the time to come, that's a good idea. I can look at that. Thank you.
That's it. Right, that's the end of the Q&A. Thank you all for your very active discussion. Thank you very much.
Next up, we have a group of very talented kids who will bring to us a lively performance.
Hi, actually, so it's nice to be here, and we're just a bunch of kids actually from a church, and then we're just gonna sing a few songs for you guys, and we hope you like them. Which is, yeah.
Is this working? Yeah, it is. It's working. Great.
My name's Adele. This is Isabel, and on the guitar we have Jason, and on keys is Ian. Yeah. So. Okay. So the first song we're going to sing is actually It's Close to You by the Carpenters. So just going to sing.
Do birds suddenly appear? And every time you are near, just like me, they long to be close to you. Why do stars fall down from the sky? And every time walk by, and just like me, they long to be close to you. On the day that you were born, the angels got together and decided to create a dream come true. So they sprinkled moon dust in your hair and golden starlight in your eyes of blue. That is why all the girls in town follow you all around. Just like me, they long to be close to you. Born, the angels got together and decided to create a dream come true. So they sprinkle moon dust in your hair and golden starlight in your eyes of blue. That is why all the girls in town follow you all around.
Okay, so for the next song, I'll take the keys.
Yeah, we're just gonna switch around a bit.
This is
So this song is gonna be this song is a Chinese song. It's called 爱如潮水. It's pretty famous 90s song. Hope you guys enjoy it. Thank you.
不问你为何有眼泪，不在乎你心里还有谁，请让我给你安慰，不论结局是喜是悲，走过千山万水，在我心里你永远是那么美。
既然爱了，就无怨无悔。再多的苦我也愿意背。我的爱如潮水，爱如潮水将我向你推，紧紧跟随。爱如潮水，它将你我包围。我再也不愿见你在深夜里买醉，不愿别的男人见识你的妩媚。你可知道这样会让我心碎？答应我，你从此不在深夜里徘徊，不再轻易尝试放松的滋味。你可知道这样会让我心碎？既然爱了，就无怨无悔。再多的苦我也愿意背。我的爱如潮水，爱如潮水将我向你推，紧紧跟随。爱如潮水，它将你我包围。我再也不愿见你在深夜里买醉，不愿别的男人见识你的妩媚。你可知道这样会让我心碎？答应我，你从此不在深夜里徘徊，不要轻易尝试放松的滋味。你可知道这样会让我心碎？我再也不愿见你在深夜里买醉，不愿别的男人见识你的妩媚。你可知道这样会让我心碎？答应我，你从此不在深夜里徘徊，不要轻易尝试放松的滋味。你可知道这样会让我心碎？你可知道这样会让我心碎
Okay. And next song, we're gonna sing a song that I'm sure everybody knows. And it's another Chinese song actually. But I think everyone will still know it because it's 月亮代表我的心. So.
的爱也真，月亮代表我的心。你问我爱你有多深，我爱你有几分，我的情不移，我的爱不变，月亮代表我的心，轻轻的一个吻，已经打动我的心，深深的一段情，将我思念到如今。你问我爱你有多深，我爱你有几分，你去想一想，你去看一看，月亮代表我的心，轻轻的一个吻，已经打动我的心，深深的一段情，将我思念到如今。你问我爱你有多深，我爱你有几分，你去想一想，你去看一看，月亮代表我的心，你去想一想，你去看一看，月亮代表我的心。
Okay, next song is actually another old song which should be quite familiar. It's Stand By Me by Ben E. King. Okay.
Sorry, just don't mind me while I just this.
When the night has come and the land is dark and the moon is the only light you'll see, no, I won't be afraid. I won't be afraid. Just as long as you stand by me. So darling, darling, stand by me. Oh, stand by me. Oh, stand
by me.
Stand by me. Stand by me. If the sky that we look upon should tumble and fall, and the mountains should crumble to the sea, oh, I won't cry, I won't cry, I won't shed a tear. Just as long as you stand, please stand by me. So darling, darling, stand by me. Oh, stand by me. Oh, stand
by me.
Stand by me.
stand by me
whenever you're in trouble.